Welcome to Business Talk on businesstech.co.za. I'm Michael Avery, and this morning we're diving into a sector that affects, I think, every single one of us, usually at the worst possible moment, and it's healthcare. And whether we're debating our contribution increases as we do at this time of year, whether we're worrying about the NHI or trying to decipher that medical aid statement that reads a bit like a cryptic crossword, I think the business of health has never felt more complex. Well, joining me to make sense of it all and hopefully reduce our collective blood pressure is Damian McHugh, Chief Marketing Officer at Momentum Health. Damon, great to have you on the show. And, as I said, the business of health does feel very complex in South Africa, given what we're grappling with NHI. It was interesting to hear what the finance minister said in the mini budget about medical aid tax credits. So I wonder if the health minister was paying attention to that. From where you're sitting at Momentum, how is the sector changing from your vantage point? And what does it mean for consumers and funders alike?
Well, firstly, Michael, thanks for having me on the show. I think when you think of health as a business, it's actually a weird concept, right? To think that all of us, our health is perhaps the most important asset individually we have, and to think of that as a business seems a little bit weird. But I understand the question. I think the business of health in South Africa is probably in its, I would guess, at a very unique tipping point type of process. We all have medical schemes, as you say, and the contributions are outstripping inflation. At the same time, we have legislation or legislative challenges that are coming into place, and how is it going to affect the sector? How does it affect my medical scheme? How does it affect my premium? Lots of, I guess, uncertainty. But perhaps the biggest thing I can touch on is we're seeing a change in the way the consumer understands health and the way that they are managing and taking care of their health. We are far more becoming a preventative focus than what it is a reactive focus, i.e. I'm only going to look at my healthcare when I'm sick. We are seeing, and I'm glad for it, we are seeing consumers who are going, how do I make sure that I don't get sick? How do I make sure that I take care of myself? That, to use a term, lifespan and health span, we're all going to live for a particular lifespan, but how do we make sure that our health span over that course of our life is really, really good? And I think that's what we're beginning to see changing in the consumer mind is what do I do today, and how does it help me become healthier? Because if we can do those things well, premiums can become lower. If we do those things well, legislation becomes less impactful on us, because the more healthy you are, the more the less health care you need to use.
Yeah, there's that old saying, prevention is better than cure.
Absolutely.
And it's really encouraging to see that that's where we're heading, because I think it's a great way to try and get ahead of runaway healthcare costs. And we know medical inflation runs in excess of consumer inflation. Where does Momentum Health position itself in this kind of evolving ecosystem that is now looking at kind of more of a preventative, early intervention stage of healthcare?
I think, look, for two things, people are going to get sick, and we need to make sure that our solution sets are there for when you're ill. So everything I'm going to share with you is in that context. We buy healthcare insurance or medical aid cover or whatever. Those things are different, but we buy them to make sure that when we are sick, when we have that motor vehicle accident, when we have that chronic disease diagnosis, that those elements of our healthcare can be taken care of. But what we are really trying to do is help the consumer understand what they can do to prevent some of the onset of those things. So we used a slide actually recently in one of the launches that we did, where we were able to show how many people in South Africa actually die of, if I can call them, lifestyle-related illnesses. So, we often talk about hypertension. You spoke about blood pressure, diabetes, those types of things actually cause more deaths in South Africa. And most of us die from those types of things than what we would out of a car accident or something. So, and that's the sad thing, right? Those are things that we can actually prevent. Those are things that if I do something different today, I can actually make a change. So we have, through our Multiply program, which works in an integrated way with our medical scheme, launched some unique features which help a consumer understand where they are at in their health journey. So very, very simply, pretty much the way I'm looking at you now on the screen, you can scan your face using your phone. So you literally just hold your phone up and you kind of scan your face, and it gives you an idea of how healthy or how sick you are. The technology that we have available to us today is really quite incredible. And then based on that, we start in a personalized way, prompting you to do the right thing based upon what we have learned about you. Now, obviously, if you're a new customer, that's all we know about you. But if you're a customer with us that's been with us for a long period of time, we've got your claims data as well. We understand what you've been claiming for. We understand what conditions you have. We have a better understanding of you than maybe what your, than maybe what your own doctor might have, in a way, because we get claims from lots of different places. So it's our ability to do and couple those things together that make a difference. And when we use technology and the claiming patterns and the data that we have, and we're able to pull them together and start actually helping you as a consumer, saying, well, Damian, maybe you should do a little bit more of this. Maybe you should do a little bit more of that exercise. Maybe you should be eating less of that. Maybe you should be just taking your medicine, right? Encouraging you to take the drug that is going to help you manage your condition. So it's how do we become more proactive with you, rather than what a funder would have traditionally done, which is wait for a claim and pay the claim. We're only then engaging with you when you're ill. It's about how do we start to utilize what we know about you to be more proactive with you. We make a joke internally, but I'm not trying to make light of it, but we one day want to be able to phone you with your pre-authorization number, saying you're going to go into hospital today before you actually know about it. Wouldn't that be really good, right? Rather than having to wait for you to interact with us. But I think technology, data, these are the types of things that I believe can change the way healthcare works. And we can start to do that more proactively than what we're doing it now. And I think over the next few years, as AI and as technologies become even more prevalent, we'll be able to do that even faster and even better.
Yeah, and I mean, of course, no conversation about modern healthcare is complete without talking about technology and that data. It's also, I think, to think that you could scan my face and tell me my health biomarkers and all of that sounds great, but it also sounds that could be a little bit invasive. How are you finding members approaching and engaging with this technology? Are they receptive? And maybe you could just share a little bit more about how you as Momentum approach this. Do you build internally? Do you partner with best of breed? How do you think about delivering the benefits of the technology while maybe just, I don't want to say placating members' concerns, but addressing members' concerns around things like confidentiality and, healthcare is a very private and personal thing.
Absolutely. Yeah, I don't think it's any different from the way in which you would use, use a doctor or a nurse to take any of that testing for you, right? I think what we want to make sure is that the consumer can utilize the technology that makes most sense for them. So what we are seeing is lots of people are embracing the technology, but there's still some who prefer what we call a wet test, actually go and have your blood drawn rather than, having technology do it. And we're comfortable with that. Do whatever you feel more comfortable with. And just make sure that we are aware of what that information is, because as soon as we know a little bit more about what the information is, we can help you on your journey to become healthier. We can prompt you with the right information, but it's not done without your consent. So if you want to use the technology, you can. If you don't want to use it, you don't have to. There's nothing that's forced upon you. And same with same with going for the tests. If you were doing them at a doctor or a nurse or your pharmacy, you choose to go and have those tests done, so you get a better understanding of how healthy or how sick you are. If you make those choices, we can help you better. If you don't make those choices, well, we're going to be reactive with you, because that's all we're going to know about you at a particular point in time. So Michael, there's nothing in there which is a forced behavior or trying to get you to do something you don't want to do. It's there to partner with you. We make it part of our rewards program. So by doing it, we reward you. We have what we call a health returns inside our multiply program. So we actually reward you with real money. And I think that's always one of the ways that people kind of get over some of those things, is if you make the incentives big enough, that the people are prepared to participate within them. So, I mean, if you think about a contribution of, 3,000 or 4,000 Rand a month, if you're on a hospital plan or, family size, you could get almost 2,000 Rand of that back every single month by engaging with the health returns program. So we try and make the incentives quite big so that people start to engage in it. And the first part of that is legitimately such an easy thing. You have a health assessment, i.e., you go and have your screening done either digitally in the comfort of your own home, or at a medical practitioner. The information is held in the same place that your medical information is held if you were sick. So there's no risk of that information being being leaked out. I mean, obviously people can get scammed, hospitals can get broken into and your files can get stolen. Those types of things still exist, but we do everything we can to make sure we protect your information in a very personal way. And that information isn't even shared with your partner. So if, as an example, my wife was diagnosed with cancer, I can't access that, or she's diagnosed with HIV, I can't access that. So even as her husband, I can't have access to that information. So, POPIA is important, and we want to make sure that we protect everybody's information. But, that's the least of the consumer's worries. I think what's the most important thing is how they're doing healthy. What is their health status? Where are they at? And how can we help them become healthier? And we think if we give them the right incentive, hopefully, they will engage in a more willing manner.
Yeah, and I think, listen, most people, if you look at everyone wearing a wearable of some description, or following their steps and how they're doing, I think we've become so used to it that we want to engage. That's a big incentive financially, though, and I think it's such an important approach to nudge people into making the right decisions, because often when you've got so many things on your plate, think, oh, I just don't have time to do that quick assessment. But if you look at it and the money that you're saving, I think it just really is a no-brainer. Takes an interesting component in the South African context, because we talking about the G20. They've just released a big inequality report, and often tech could widen some of those inequality gaps. So what measures are you prioritizing to ensure that these reforms and innovations genuinely benefit all South Africans, including those in the underserved and more rural communities in South Africa?
One of the things, so firstly, I think we must also understand South Africa's private healthcare system doesn't cover everybody. In fact, it covers a very small portion of our population. Probably around 8 million out of the 65 odd million people in South Africa have access to private healthcare. And a large portion of that is cost driven. Medical schemes have a minimum premium almost because of some of our legislation requiring prescribing and benefits, and therefore the premium is above what most members, particularly the unemployed, can afford. So we launched a health insurance product in order to be able to try and assist that sort of lower income, formally employed, or even, I guess, less formally employed employees. And there we also use technology to try and help that sector get access to healthcare. And really that came out of, we had this product that's called Hello Doctor long before COVID. In fact, the telemedicine type of service where, someone could just phone a doctor and get healthcare. But we weren't allowed to pre-COVID actually be able to give healthcare advice over telephone. It was not allowed. Then obviously COVID happened, and all of a sudden the whole world changed. And so what we've done is we've made primary healthcare available over the phone. And Michael, it's changed the way consumers consume healthcare. Not every South African, in fact, the vast majority of South Africans don't have access to cars. They don't have access to their own car. Public transport is often only available during business hours. You don't get a bus late at night, or taxis maybe not running. And in areas where a lot of South Africans live, sometimes it's not even safe to leave or be out late at night. And so having technology which brings healthcare service into the patient, into the member's home, has changed the way we see healthcare being delivered. So we are trying always new different ways of creating healthcare, more accessible health to more consumers. I mean, our purpose as a business is more health for more South Africans for less. And we want to try and get people access to better quality healthcare more often, but also not just the healthcare when they get sick, better quality health, but to understand that their health is what drives healthcare. And if we can prevent them from being ill, better. You used the analogy just now. I'll use another one. Stitch in time saves nine, that preventative analogy. And so if we can get a consumer to get the right quality healthcare early on in their healthcare journey, often the cost of healthcare is much less later on. So, so getting, access to healthcare 24/7 without it costing them anything, by just using USSD technology on their phone, we can actually call them back, get a doctor to speak to them. And if it's something that's really urgent, through that call, we can often help them, by saying you need to go to hospital or you need a specialist. But the vast majority of cases, we're actually able to deal with that case over the phone. Now, what's happened is, then we get, food delivery. Now we can get pharmacy delivery. So we could actually get the medicine delivered to them at their home without them having to leave. And so we make the whole healthcare delivery chain that much easier, particularly for individuals who don't have access to transport, to doctors and so on. And we do it, for mostly, we don't offer this necessarily in a retail context, but, in companies. And what we've seen is just a significant uptake in the use of healthcare and the way it's used, because of its convenience, and not
Yeah.
having to sit in day clinics or having to sit outside a clinic all day. We did it just recently for a very large employer group who offered it to all of their 25,000 employees who were previously, being served by the public sector. And I had a chance to speak to a few of their staff members, and the tears in their eyes, just going, "This is the first time I'm ever going to have private access to private healthcare. This is a game changer for me."
Wow.
One or two of them said, "I used to wait so long in the queue. I almost got healthy while I was waiting." And she was joking, but I mean, but you kind of get a sense of how
Yeah.
long they would wait for
Yeah.
healthcare. And what you and I get is, we phone a doctor and maybe an hour, maybe two, depending on how big, how long the doctor's waiting room is. We're able to see a doctor straight away. But the ability to do it from their own home, being able to put their children on and get access to healthcare, is really, really a big game changer. So technology does bring health and healthcare to more people. And we can't necessarily do it for everybody in the country, but we want to be able to play our part as momentum in making that change, in helping people get,
Yeah.
get better quality healthcare when they require it, and making private healthcare more accessible to more South Africans.
I don't think, and Damian, you and I sit in a very privileged position, and I think many of us watching this might sit in a similar position as well. I don't think we fully understand this gap, this chasm that we have between the private and the public sectors. And I think, one of the biggest public frustrations with healthcare, but it's in the public and the private, I think, is the cost quality trade off. And we've got this, this kind of trifecta here. You're trying to balance affordability with long-term sustainability and schemes. And you mentioned, sadly, the regulatory environment and the low cost benefit options have hamstrung the schemes a little bit. So they're trying to grow the base of the pyramid, get younger members on, and that's tough in an economy that's not creating the number of jobs that it should. And so you've got to balance that sustainability with quality. So you've got affordability, you've got long-term sustainability and quality of care, all of these things coming together. How do you do that at Momentum without compromising one of the three?
Yeah, it's unbelievably tough. I think the first thing is, I think many people in South Africa probably think that medical schemes are owned by, like Momentum Medical Scheme is owned by Momentum, and it isn't. It is owned by its members. We help with the sustainability and claiming and setting pricing, but we don't make any profit out of a medical scheme premium that accelerates by 10 or 15%. That's not profit that Momentum makes. That is because the sustainability of the scheme is under pressure, or claims are exceeding contributions because they're non-profit entities. So it is
Yeah.
it is a it is a it is a critical balance, Michael. We understand that consumers in South Africa are under pressure, and a consumer today is paying significantly more for a range of different services, and healthcare for a while, or private healthcare for a while, has outstripped normal inflation between 3 and 4%. And it's probably no different this year. If you look at the averages across, the increases across the medical scheme industry, it's quite similar again. So I guess the important thing is, for what we try to do as Momentum, is try and keep the price shocks out of that system. So
Mm.
in our view, a consumer would rather get 999 than 529, and you want to try and keep the shocks to the consumer at a minimum. But at the same time, you also want to try and make sure that benefits remain the same. So, you talk about the sustainability of benefits. I think Momentum, for sure, it's more than a decade now. I must actually go back and actually find the exact dates, but it's probably about 13 years. The benefits inside the Momentum Medical Scheme have not decreased. Now, that in itself is quite unique. Most of our competitors at a particular point in time in these last 13 years have reduced something by some percentage in order to keep price sustainable. Because if I take
Mm.
benefit away, and i.e. what I pay for, I can make price lower. But if I keep benefits set the same over a period of time, you can imagine with the cost of inflation in healthcare, that price should become more expensive. So keeping benefits the same is quite a unique thing within our market. We often just focus on the price. We don't often focus on the value. So the sustainability and the lack of, if I can call it, shocks to the consumer are important for us. So we try and keep those two things as stable as we can, but in the environment in which we play, which is, as you rightly indicated, the younger and healthier people in South Africa aren't necessarily joining medical schemes. And as they join, they think they're bulletproof. They think and they probably are to a large extent. They're a lot more bulletproof than what I am. But they do tend to think that way, and then they don't join. And they only join later. Now, that challenges a cross-subsidy model that we have in the medical scheme space, is that we need the younger people in the environment to help cross-subsidize some of the older, sicker people. As the population in that medical scheme gets sicker and older, then the cost of that's going to become more higher, particularly if you're keeping benefits the same. Now, if I make benefits less, then our premium can be more stable over that period, hoping that younger people join. But what we really need is we need more employed people in South Africa buying healthcare. We need to make it more accessible. We need to make it cheaper so that the younger people see the value of it, and helping the people like me now, get cross-subsidized as I get sicker and older. But before everyone thinks, I joined the medical scheme because Damian's getting older. Remember, I was younger at some point in time and helped the older people when I was a younger one. So I'm just asking for a few people to help me with that as well. But that's part of the challenge we have in the legislative space, right? Is our legislative world is there to protect the medical scheme industry and its people. But I guess, the act was written in 1998. We're in 2025 now. It's a I don't want to use the word old piece of legislation, but it's definitely not refreshed for the current challenges that we're experiencing in our healthcare market today. So there is room definitely for improvement in the way we design products, but also the framework under which they can be designed.
Yeah, well, it wouldn't hurt if the regulator we finally moved forward with the low-cost benefit options, allowing medical schemes to innovate in the way that we're seeing the innovation in the medical insurance space. That, I think, it would be a good first start. But, we're speaking of legislation, and we see the reforms continuing to roll out. We mentioned NHI earlier. There wasn't really any new money in the budget for it. So again, it seems to be this big idea, lots of pie, very high in the sky. We don't seem to be moving forward with it. So how do you then, as Momentum Health, how do you innovate? Do you build for what exists now, or for what you suspect may be coming down the pipeline?
I think you do both, Michael. I think you have to innovate for the legislation that we currently have, but you also have to think about the way the consumer is thinking about healthcare into the future. So Momentum, fortunately, has a DNA of innovation. So we were one of the very first medical schemes to launch what we call efficiency discount options. And I don't want to get technical about that, but basically inside, if you think of a car, right? If you're going to buy not to plug any brands or make any brands, feel any worse. But let's say you're buying a Toyota Corolla. Let's say you and I have the same family size. You're buying a Corolla and I'm buying a Corolla. Inside that car, you can do different things. You can decide to put leather seats, electric windows, power steering, and I can choose just the standard cloth, no power steering, no electric windows, wind down. Yet we've got the same shell of a car, right? We've both got the Toyota Corolla, let's call it a 1600 engine in it, but there's some things in your car which are different from the things in mine. And because I've given up, if I can call it, some of the frills, I pay a cheaper premium. Now, that's what we did with medical schemes, almost 15 years ago. We gave people choice inside the option to choose a hospital network. In other words, not leather, you can go anywhere you like, versus, hey, pick out of this hospital network. We did the same with chronic. You can choose 3 different places where you can get your chronic medicine from. You can choose to get it from any pharmaceutical provider you choose, or a network of pharmacies, or the state. So you can make choices that then affect your premium, but we're still buying exactly the same option. And we built products like that. So it gave consumers more freedom, more flexibility, without decreasing the value of cover. In other words, I'll get R1 million worth of cover in any one of those settings, but the setting in which I can spend R1 million is different. And as a result of that, the freedom of choice that the consumer gave up gave them the power to reduce their contribution. So we designed those some 15 years ago, if not longer. Lots of other medical schemes have copied that. We have savings accounts that most medical schemes keep in the boundaries of the Medical Schemes Act. We've got what we call a health saver account that sits outside of that. So it's still a healthcare savings account, but it sits outside the Medical Schemes Act. So I don't have a limit on what I can put in it. I don't have a limit on the size of it. I can use that savings account to pay for a vet. If you want to put your your furry friends or your furry, family members on your product. So there are different things that we can do. In fact, the money we pay you, that health returns money that I spoke about earlier, by living out a healthier life, we pay you money back. We pay it into that savings account. So now actually you leverage your health as an asset. The healthier you are, the more you earn. The more you earn, more goes into your savings account, and you didn't actually pay for it. You can actually earn your savings. So we've got clients of ours who buy a hospital plan. A medical scheme product is a pure hospital plan. There's no day-to-day cover at all, and they earn that day-to-day cover for free. So they build their own savings account on their health assets. So much cheaper premium, but no less cover than what you would be buying in your cover, but having to contribute for it. So we've tried to be quite innovative. In fact, we even allow members who build up savings accounts over a period of time to transfer that money out of their savings account into a retirement fund. So you actually, again, leverage your health as an asset. By the healthier I live, the better I live. I can move that money into, and where savings accounts inside medical schemes are quite restrictive in what they're allowed to do. Again, not the fault of the medical scheme, fault of the legislation. So we've tried to, within the law, be a little different, be a little innovative, which we think will speak to a different consumer, a healthier, conscious consumer, that then starts to look as their health over a journey of time, not just, hey, I'm sick, can you pay my claim? Yes, we will. Like, hey, can we get involved with you with helping you become healthier? This is what some of the benefits of those types of things can be over a period of time. So, I mean, I come across many, many people who have, and I know it's going to sound quite crazy to many of the listeners, because most of us finish our savings accounts in February and March of a year. But I come across many people who have 100,000 Rand in their savings account that they've built up over many, many years. And the interest on that is almost zero in a medical scheme savings. But if they get in a health saver account with Momentum, that 100,000 can be used for a lot more things. Like, imagine putting 100,000 in your retirement fund. What that 100,000, if you're 30 or 40, would be by the time you retire, probably chasing what most retirements do, CPI plus 2 or 3%. All of a sudden, healthcare is not a separate financial service. All of a sudden, healthcare is the foundation of your financial services, because if you live healthier, you can actually retire better. Again, health span, lifespan. Not just live long, live healthy while you live long, and you can do so financially more stable. So, to answer your question, is we need to be innovative. We have to do it within the boundaries of the law, but there are ways to be perfectly legal and still deliver something that's quite unique. And we've got a culture of being quite innovative, and we're going to continue to try and help the consumer in that legislative space to utilize healthcare in the best possible way.
And that also definitely speaks to, I think, what many new entrants to the job market, the labor market, would be looking for in terms of having that flexibility and hopefully attracting that younger cohort of member as well. Just if you were to look into your crystal ball a little bit, Damian, and I know it's difficult given NHI and everything that's going on, where you see the future of healthcare going and what's important for consumers and businesses alike to bear in mind when they're planning for the future. What do you see coming down the horizon?
I think the first thing is NHI is not going to be here to save us. So I think I bump into quite a few people going, okay, well, NHI is almost here, I don't have to worry. No, I think NHI is going to take a little bit of time before it starts to impact our ability to lower healthcare costs, because I can get it from the state. I just don't see that happening in the short to medium term. So make sure you're not denying your employees cover, as if you are an employer who's making decisions. I'm not saying you're denying them, but try and provide opportunities for them to have access to healthcare cover. Healthcare cover is, as I said earlier, I may be a little bit biased because I've worked in this industry for a long time, but there isn't a more important asset that you or any of us or any of your listeners would have than their health. And I often ask this question of somebody. I've asked many audiences around the country when I do talks, is to say, if one of your loved ones got sick, what would you spend in money to get them healthy again? Would you spend everything you have? And all of us would. I've never had somebody, unless it was their mother-in-law that got sick, but I've never had somebody who said, I wouldn't spend everything I have to get my loved one healthy again. And if that's true, then the savings you're making, the investments you're making, the home that you're buying, the car that you have, all of those things are less important than your health. So in the future, I don't think that changes. So the most important thing I think that any consumer can do is look internally and go, what have I done today that improves my health? And what should I stop today that stops me from improving my health? Whether it's what I eat, is it a bit more exercise? Is there something that I can do today that can actually change the way I think about my health journey? Because if you can make those small incremental healthy habit changes, you'll be able to have a big impact on your health journey. Now, think of that in 10 years from now. All of a sudden, you're living a healthier life. The medical aid option that you need to buy is one less than the one you're currently buying because you're healthier.
Yeah.
Well, then you've saved money. You as a consumer have saved money. And if every one of us could do that, what happens? Well, all the employers that we work for, all the medical schemes that we belong to become more productive. We can become a healthier medical scheme, which means our premiums are lower. And if we can do that as a consumer base, the whole health of South Africa improves. So I know but if we personalize it, just make it for me today. Why would I do that? Well, maybe, my kids are getting older and they're going to have grandkids, and I want to be able to throw a ball in the garden with my grandchild rather than be less active. What is your why? Have a good why, live a healthier life, and financially you'll be better off, but also you'll live a better retirement because you'll be more active, more flexible, more healthy. So the future of healthcare, I think, is going to change in South Africa. There's no doubt about that. Legislation is going to change, hopefully for the better, which allows companies like ourselves and our competitors to be more innovative for you, to design better products for you that enable a better health outcome for you. But none of that changes, even in an NHI system, if you yourself aren't healthy. Let's assume the absolute worst case scenario. Let's assume that medical schemes don't exist in 10 years' time, and we're all in a national healthcare system, which the government does really badly. I'm not saying they will. Let's assume it's done unbelievably badly. Then what's the best thing that can happen for you? Is don't be in that system. So be healthy, so you don't have to go and use it, right? Now, I'm hoping, and I really do believe that South Africa won't have a healthcare system that is going to fail, whether the private system is working with the public sector together, whether it's a public sector system, whichever one of those is, it makes no difference whether that system is good or whether that system is bad. What you can control is how much of that system you need to use. So be healthy, look to live a healthier life, and make those small incremental changes today that can help you live a better life into the future. We have a program called Multiply, which is designed exactly for that. But some of our competitors have similar types of programs. I personally don't think they're as good, but they do have they do have ones that you can use.
Yeah. Damian, what you're speaking of is a global trend at the moment. You look at the likes of Brian Johnson, the billionaire who's trying to live forever, and he has a regimen of doing 100 different things a day. But there is a global movement to be healthier, to live a more productive life as we age. You read the likes of Atul Gawande and Being Mortal, studying which global systems, which societies are ensuring that we have quality in our old age. You don't just want to be living longer, but spending the last 20 years in and out of hospital. To your point, you've got grandkids, you want to be able to throw the ball. And I love that because, it takes ownership back into your own locus of control and not worrying about government or NHI or anything like that. Damian McHugh, thank you very much, CMO of Momentum Health, for cutting through the jargon and for helping us make sense of a healthcare system that, as I said, often feels very overwhelming for most members. Great to hear what you're doing, building a system that I think actually works for real people. So thanks for the insights, and I look forward to catching up in the future. Take care.
Thanks, Michael. Appreciate it.